Hi, my name is Daniela and I'm a psychiatrist and I work for the private therapy clinic. I've been fortunate enough to start training in Romania some time ago, and then I continued my training here in the UK. So I've been practicing here for a really long time, got my qualification. Experience-wise, again, fortunate enough to work from community to medium secure units, doing from child and adolescents to adults, and I found that extremely empowering. Initially was anxious to go from one module to another module and get jobs and those experience, but it really helped with the understanding of all mental health difficulties, from all the difficulties when you discuss about neurodiversity, learning disabilities, child and adolescent, anxiety, to more risky situation requiring hospital admission, medium secure units. So yeah, I've been fortunate enough to go through a wide range of experience and working in various settings. I've started recently working privately and I enjoy not necessarily, preparing for seeing people, just connecting with them, learning about them and about, their own difficulties. When someone books to see me, either they have the option to see me face to face if they choose to, and that are going to happen here in London or online. I think, practically most people are going to opt for the online version. Either they will, send a summary of their own, difficulties or what they want to discuss prior to the meeting, or if they choose to, they're just going to book for the appointment and then we'll discuss there and then about their difficulties and have an understanding of how we got to this point where they needed to see a psychiatrist. I think everyone knows that majority of the time, people feel a degree of, either emotional pain or distress, and they're seeking answer, hence they're approaching a psychiatrist, either for understanding, a diagnosis, a formulation, or clarity when it comes to the treatment pathway. Over the years, the main approach that actually aligns with my style of working in psychiatry is a holistic one. And I think, looking at an individual from all aspects of their own life, mental health, physical health, social, financially, recreational, it does help. And I think every piece of this puzzle plays a part in our own mental health well-being. So having a holistic approach, it's crucial. At times, when we struggle with our mental health, it has that, domino impact on our quality of life. So if we feel, anxious, our whole quality of life diminishes, we'll end up, restricting things. Same when it's going to happen when it comes to, other neurodiversity, because we feel different. Same when we feel, depressed. So in various areas of our life, this has an impact. So trying to understand the difficulties, but also what sort of mechanism we put in place about, structure, about, routine, about, supportive network. It does help. And I think, empowers the person to look at themselves outside of any condition and any diagnosis. And I think it's crucial when you discuss about, someone's understanding of their own difficulties. Every single time when we discuss about, health, making things of the definition of health, and for years and years, and I think it's the same applies. Definition of health is the absence of illness. So it's quite interesting, to have that definition of health by omitting illness. We can't discuss about us as well-being and human beings without considering physical health and mental health. Do I think that everyone is at risk from suffering? Definitely. And I think everyone in their life experience grief, bereavement, feeling low, feeling depressed, feeling suicidal, feeling that they can't cope with life, feeling anxious, having difficulties with their sleep. It's impossible to be alive, to be a human being and not have those difficulties. Problem when it reaches an impact on our ability to function, on our relationship, on our ability to either study, work, maintain healthy lifestyle, yeah, that's borderline into the illness. And I think this is where more resources are needing into supporting young people or anyone with those sort of difficulties. We're all at risk of becoming unwell. Nowadays, society also, it's happening at a fast pace. And it's, with all the encouragement and communication, we tend to struggle to accept who you are, to end up, developing a sense of self. And I think, with so many models around it, we've kind of like lost at times our own ability to find our own voice. And that is exactly, crucial when it happens with young people. And yeah, I think we're all at risk when it comes to, becoming unwell. And I think, having the empathy that this can happen to anyone, to our loved ones, will raise that, awareness and more discussion about meaningful condition when it comes to mental health. From trauma to emotionally unstable to becoming anxious to any other condition. Someone said that when you do something you love, you don't necessarily feel you're working. And to be honest, majority of the time this is how I feel when I do psychiatry. I'm really passionate about what I do. And I think, having that ability to connect with another human being, to make them feel at ease, to try to understand, to show some empathy. People coming to see a psychiatrist or, a psychologist or anyone within mental health, they're vulnerable and they're in pain and they're asking for help. And I think, as professionals, we are in this fortunate position where actually we can understand people and we can make them feel at ease and we can explain and help and give them some guidance. That in itself, it's a joy for me to work. I don't necessarily feel drained because of work. How I used to unwind, and I think, pandemic took a toll on everyone. It was just traveling, seeing new places, reading and music, definitely. Just music and some dancing. But over the last few years, life gets busy, life gets in the way. So my home is my safe place. My relationship and my children, this is everything I need in order for me to charge my batteries. So I'm fortunate enough just to have that personal safe space that helps me. If you want to understand yourself better, and if you want to have those discussions in a safe, discreet, supportive environment, come and find me at the private therapy clinic, and I'll be here to listen, not judge, understand, and then as much as possible, help and support.